So today, what we're going to be talking about is the number one reason that offices are not getting new patients. And it's very, very simple. I'm going to give you a super simple framework. And at the end, I'm going to give you the scripting on how to fix it, the exact scripting. And I promise you this will work. I guarantee it. If this doesn't work, I will give you $100. You use this, I will give you $100. You come see me, and I will cash app you $100 personally, because I've never not seen it work. Okay. And what the problem is that we're going to solve is on the phones. Did you know there's only 4 questions that a new patient is going to ask your office, and your team is getting at least one of them wrong? And the one that they're getting wrong is actually the easiest to solve. So we're going to work through that today on the live stream. And if you're here on YouTube or Facebook or wherever you're watching, just drop a comment down below. Let me know how the quality is. And at the end, I'm going to give you the scripting to solve this with a money back guarantee, $100 guarantee. Okay. So let's jump into this. Welcome back to another episode of Dental Marketing Go. I'm your host, Gary Bird. I'm the owner of SMC National, where we help offices just like yours level the playing field against the big guys out there so you can grow the way that you want. But you can't grow if you don't know how to answer the phones correctly. Now, don't tune me out. I'm going to give you 4 frameworks or 4 questions that you're going to get on the phone. And these are the only questions that new patients have. Do you know the 4 questions? If not, then your team's probably not trained up on them. And they're not as hard as you think. They're actually kind of easy, but you got to have the right scripting on it. And if you don't have the right scripting, you're not going to be able to answer them. This is the number one reason that people are losing their new patients, okay? And you just can't see it. It's invisible to most offices. And here's the red flag that you want to listen for. If your team keeps saying, oh no, they didn't schedule, they were just shoppers, that's your red flag that you're losing dozens or even scores of new patients on the phones. And then I'm going to give you the exact scripting on how to fix this, how to train your team, and with a money back guarantee. I'll give you $100 if you use this scripting and it doesn't work. Okay. Now let's jump into it. So what are the 4 questions that people or patients will ask on the phone? There's only 4 of them. There's only 4. So let's go over those really quickly. Number 1, how much? How much does this cost? And this is the one that messed most people up. I'm going to give you the exact scripting on this, okay? But let's talk about the other questions. When can you see me? That's an easy one, right? Now, if your team is putting new patients weeks out, you're going to have a high no-show rate of those kind of new patients from marketing. Patient referrals will wait, right? That's fine. But marketing new patients won't wait. They'll end up scheduling somewhere else, and then you'll get a no-show, and then you'll be mad. And you'll say, these are low-quality patients. No, you schedule them too far out. Okay, so that's the win. And then the hardest question is the insurance question. Do you take my insurance? Now, I've listened to thousands and thousands and thousands of new patient calls personally. Plus, I have a team of, I don't even know how many people we have on the team that listen to all the phone calls. Tons of people that listen to calls. And we pour through all the data. And this is exactly how almost every patient asks this question. Do you take my insurance? Now, I'll tell you this one. This one's the trickiest one, because even when you do take insurances, or even if you do bill to the insurances, your team hears you complaining about insurances. So your team just says this: we're not in network with those insurances, and you are just losing new patients from that. If you are an office that takes insurances, not necessarily in network, but you bill to the insurances, you have to say, it's very simple scripting. You have to say it just like this. Oh yeah, we have a lot of patients that come here with that insurance. Let me get your information. Let's get you in. We'll do a complimentary benefit check. The reason that you have to handle it that way is insurance is super confusing. It's confusing to your team. It's confusing to you. It's confusing to the patient. And guess what? It's literally created that way. It's literally created that way. You might be thinking, like, why did they do that? Why do the insurance companies do that? Have you ever seen the movie Incredibles, where Mr. Incredible is in his cubicle and he's working and he hates his job, and a little old lady comes in and she's like, my house burnt down. They won't pay for it. How does this work? And Mr. Incredible comes in and he whispers to her. He's like, submit this form, do this, say this. And he gives her the exact steps, and it's really confusing. And he says, if you do that, they'll pay out. Insurance companies do that on purpose. It's not a bug, it's a feature. They put it in there on purpose. They make everything confusing So that way, people don't use their benefits. The harder they make it, the more friction that they create, the less people that use the benefits, which means the more profitable the insurance companies are. So you have to just make it super simple. Yeah, we have a lot of people that come here that have that insurance. Come on in. Now, if it's a Medicaid insurance and you don't take Medicaid, don't answer it that way. Obviously, I'm not talking about state insurances. I'm not talking about HMOs. I'm just talking about PPO. So I want to be really clear on that. So how much is question number one. When can you see me? Question number two. Do you take my insurance? Rarely does a patient ask if you're in network with their insurance. And then, do you do this treatment type? That one's easy, right? Yes or no? Yeah, we do. We have lots of patients that we do that for. Okay, so let's talk about the hardest one, the one that you're losing the most patients on. How much? And here's what your front desk is saying. Oh, they're just shoppers. Let me help you with this. Every patient is a shopper. Every dentist is a shopper. I've never worked with a dentist that wasn't a shopper. Every single new patient is a shopper. Every patient referral is a shopper too. They've just already done the shopping and got the referral, and now they're done shopping. So the marketing patients are shopping. However, they don't know what they don't know. So they're asking questions. They don't know what to ask. They don't know how to say, well, are you going to be able to clinically help me better than this other dentist? They don't even know how to ask that question. So the only question that they know how to ask is, how much is a crown? How much is a filling? How much is an implant? Now, let me break down the ways not to answer this question. The worst way to answer this question is just give the pricing. Don't give the pricing over the phone. It's irresponsible of you to quote clinical pricing over the phone without looking at the patient. It's just, you can't do it. You can't do it. And you can give ranges and things like that if you want, but that doesn't really work. Okay? Because here's what's going to happen. They're going to call you, and then they're going to call the next guy, and eventually somebody's going to lie to them and say, oh yeah, an implant, that's $300. They're going to be like, man, everybody else said it was $5,000. And then they're going to go in for the $400 implant, and they're like, oh yeah, that's for the implant. But the crown and the abutment is another $4,000. They're like, whoa. Right? And this is why people distrust dentists, because people do this stuff. Okay? So don't do that. That's not right. Now, you also can't do this. We don't give prices over the phone. That's a guaranteed hang up. No patient has ever converted off of that. We don't give prices over the phone. And then they go, yay, your team goes, yay, we weeded out another shopper just like doctor wanted. Yeah, you just lost 30, 40% of your new patients. Just because someone wanted to know how much is a crown. Because they don't know what other questions to ask. So if we can't give the pricing, and we can't not give the pricing, what's the correct answer? The correct answer is redirecting questions. And I'm going to give you the scripting on these. We have a whole list of them that you can just literally hand to your team and just say this. And this works every single time. There's an exception when it doesn't work, and I'm going to share that with you in a moment. Okay, so let's role play. Patient calls in. Hi, how much is a dental implant? Great question. Happy to answer that for you. Who do I have the pleasure of speaking with? Let me get your number just in case we get disconnected. All right, let's dive into this. I want to get you the information so you can know what decision to make with your dental needs. Is the tooth impacted? Patient's going to say, I don't know. How many roots does the tooth have? I don't know. That's really tricky because no one is going to be able to give you pricing on a dental implant without that information, because you might need bone grafting, you might need a more complicated surgery, or it might be super simple. So at our office, what we do is we have a consultation. You come in and we'll take a look at it and tell you exactly what's going on. What works better for you, mornings or afternoons? If you handle the call just like that, they're going to schedule the appointment. And then you can figure out what the actual problem is and give them the actual price. Okay? If you have a problem with your car right now and you call a mechanic and you say, hey, my car, it's making this noise. The engine's going, how much is it to fix that? What's the mechanic going to say? If they say, oh, we can't give prices over the phone, you're going to be like, all right, bye. And if they say, oh, yeah, that's going to be $3,000, they would never say that because you can't actually diagnose a problem that way with the car. They're going to say, well, tell me a little bit more about the problem that you're having. Like, It could be your carburetor, it could be your radiator, it could be this, that, the other. And they're going to ask you a bunch of questions. And guess what you're going to say? I have no idea. I don't even know what that is. And then you are going to end up taking it in for them to look at it. And then they're going to tell you how much it costs. And then you're going to make the decision if you want to fix it or not, right? Very simple. Dental's no different. We can't diagnose over the phone. You just simply have to ask redirecting questions. You say, someone calls in and says, hey, I want to get, how much is a filling? How many surfaces is it on? Hey, how much is this? How much is that? You ask the questions because you can't answer it. Now, if someone really presses you, just give them a range. You know what I mean? Oh, it could be anywhere from this to this. Give them a big range. But most people aren't. They're just going to schedule because it makes sense that you can't quote over the phone without the information. So if you want these questions, and the questions they ask are called redirecting questions that re-educates the patient that they don't know what they don't know. If you want these, all you have to do is comment below, whether you're on Facebook right now or whether you're on YouTube or whatever it may be, and we will get you that scripting. And it's not as complicated as you think. You take the scripting that we give you, laminate it, and then hand it to your front desk. And guess what? People are going to start coming in. You are going to notice a huge increase in your patients, your new patients specifically, going up just by solving this problem. So let me know if this was valuable to you. Give me a thumbs up, comment below. We really appreciate you. Have a great day.